Good evening everyone, how are you? Hope you're doing good. Today I'm going to talk about one of the important topic, that is antibiotic lincosamides. Let's go into the topic. The class originator lincomycin and its congener clindamycin are approved in the United States. Clindamycin has largely replaced the lincomycin in clinical practice and is principally used to treat gram-positive aerobic infections, anaerobic infections, as well as some parasitic infections. What is the mechanism of action of clindamycin? It binds exclusively to the 50S subunit of bacterial liposomes and suppresses the protein synthesis. What is the dose of clindamycin in adults? The overall dose of clindamycin for adults is 150 to 300 mg every 6th hourly, and for severe infections, we can give up to 300 to 600 mg every 6th hourly. Clindamycin phosphate is available for intramuscular or intravenous use. For serious infections, we can use clindamycin intravenous or intramuscular administrations. Is recommended in dosages of 1200 to 2700 mg per day, divided into 3 or 4 equal doses for adults. What are the therapeutic uses of clindamycin? It is an alternative agent for the treatment of skin and soft tissue infections, especially in patients with beta-lactam allergies. It is also useful for oral treatment of skin infections when MRSA and streptococci are potential pathogens. Clindamycin also inhibits the toxin production, so it is recommended as an adjunctive agent in necrotizing fasciitis or gas gangrene when toxin-producing bacteria like staphylococcus, and Clostridia are suspected. Topical clindamycin is used for the treatment of acne. Clindamycin is effective for treatment of lung abscess and anaerobic lung and pleural space infections due to susceptible organisms. It has been used as an alternative agent for the treatment of sinusitis, pharyngitis, and otitis media. Clindamycin in combination with primaquine is useful as an alternative agent for the treatment of pneumocystis jirovecii pneumonia in patients with HIV. Because of its good activity against staphylococci and excellent bone penetration, clindamycin is an alternative agent for the treatment of osteomyelitis. Clindamycin in combination with pyrimethamine and leucovorin is an effective alternative for acute treatment of encephalitis caused by Toxoplasma gondii in patients with AIDS. Clindamycin plus quinine is an alternative regimen for non-severe malaria. Clindamycin is also administered vaginally for bacterial vaginosis. What are the adverse effects of clindamycin? The reported incidence of diarrhea associated with the administration of the clindamycin ranges from 2% to 20%. In most cases, this is mild to moderate in severity and resolves on drug discontinuation. However, clindamycin carries a relatively higher risk of superinfection with Clostridium difficile infection, which causes the pseudomembranous colitis. This colitis is characterized by watery diarrhea, fever, and elevated peripheral WBC counts, and severe forms of Clostridium difficile infections may be fatal. The prescribing information for clindamycin in the US includes a boxed warning about the risk of Clostridium difficile infections. So discontinuation of the drug combined with the administration of oral vancomycin or fidaxomicin is usually effective for the treatment, but relapses can occur. Agents that enable the peristalsis like opioids may prolong and worsen the condition, so they should not be used. Skin rashes occur in about 10% of the patients treated with the clindamycin and may be more common in patients with HIV infections. Other uncommon reactions include exudative erythema multiforme, that is Stevens-Johnson syndrome, reversible elevation of hepatic enzymes like aspartate aminotransferase and alanine aminotransferase, gallocytopenia, thrombocytopenia, and anaphylactic reactions can occur with clindamycin. Local thrombophlebitis may follow intravenous administration of the clindamycin. Clindamycin may potentiate the effect of concomitant neuromuscular blocking agents. Thank you so much for your kind attention, and kindly share my lecture to your friends.